Every 40 seconds, someone's heart stops working the way it should. For some, medication isn't enough. For others, lifestyle changes come too late. That's when cardiac surgery becomes the difference between life and death. Today, I'm going to walk you through what cardiac surgery really is, who needs it, what happens inside the operating room, and how people come back stronger afterward. Introduction. Why cardiac surgery matters. Welcome back to Balanced Motion Health, where we break down complex medical topics in a clear, honest, and practical way. When people hear the words cardiac surgery, fear usually comes first. Open chests, heart-lung machines, long recovery times. It sounds extreme, and sometimes it is. But here's the truth. Modern cardiac surgery saves millions of lives every year. It's not a failure. It's often the last and most powerful tool when the heart is under real threat. Today's video will help you understand what cardiac surgery actually means, the most common types, who really needs it, what recovery looks like in real life, and how patients rebuild their health after surgery. Let's start from the foundation. Section 1. What is cardiac surgery? Cardiac surgery is any surgical procedure performed on the heart or major blood vessels connected to it. Doctors recommend it when blood flow to the heart is blocked, heart valves stop working properly, the heart rhythm becomes dangerous, or structural problems threaten survival. This isn't about minor chest pain or shortness of breath. Cardiac surgery is used when the heart's function is critically compromised and other treatments are no longer enough. Transitioning from definition to reality, let's talk about the surgeries doctors perform most often. Section 2. Common types of cardiac surgery. Not all cardiac surgeries are the same. Here are the main ones you should know. 1. Coronary artery bypass graft, CABG. This is the most common cardiac surgery worldwide. When arteries feeding the heart become blocked, surgeons create a new route for blood using vessels from the leg, chest, or arm. Think of it like a road detour around a traffic jam. Blood flows freely again. 2. Heart valve surgery. Heart valves control blood flow direction. When they narrow or leak, the heart works harder and eventually weakens. Surgeons either repair or replace these valves with mechanical or biological ones. 3. Arrhythmia surgery. Some heart rhythms are so dangerous that medication and devices fail. Surgery can interrupt faulty electrical signals and restore stability. 4. Congenital heart defect repair. Some people are born with structural heart problems. Cardiac surgery corrects these defects, sometimes in infancy, sometimes in adulthood. 5. Heart transplant. This is rare and extreme, reserved for patients with end-stage heart failure when the heart can no longer sustain life. Now that you know the types, let's address the hardest question. Section 3. Who actually needs cardiac surgery? Not everyone with heart disease needs surgery. In fact, most people don't. Cardiac surgery is considered when arteries are severely blocked, chest pain continues despite medication, heart failure worsens, valves are beyond repair with non-surgical methods, the risk of sudden death is high. Doctors weigh risk carefully. Surgery is never chosen lightly. The decision is based on survival benefit, not convenience. And yes, age matters, but it's not everything. A healthy 70-year-old may tolerate surgery better than a 50-year-old with uncontrolled diabetes and smoking habits. Next, let's step inside the operating room. Section 4. What happens during cardiac surgery? This is where fear peaks, but understanding removes a lot of it. Before surgery, patients undergo blood tests, imaging, and heart scans. Anesthesia ensures you feel nothing. A specialized team prepares for hours of precise work. During surgery, surgeons may open the chest or use minimally invasive techniques. The heart may be temporarily stopped. A heart-lung machine maintains circulation. This isn't chaos, it's controlled, rehearsed precision. Every step follows strict protocols developed over decades. After surgery, the real work begins. Section 5. Recovery, the part no one talks about. Recovery is where outcomes are decided. Immediately after surgery, patients spend time in the ICU. Breathing tubes, monitors, and medications are normal. Pain is controlled, not eliminated. The first week. Walking begins early, yes, even after heart surgery. Breathing exercises prevent complications. Nurses monitor heart rhythm constantly. The next weeks. Fatigue is real. Emotional swings are common. Appetite may be low. Here's the honest truth. Recovery is not easy, but it is manageable, and it improves steadily if patients follow instructions. Now let's talk about something powerful: life after surgery. Section 6. Life after cardiac surgery. Many people assume surgery fixes everything. It doesn't. Cardiac surgery restores blood flow, repairs structure, saves life, but it does not erase the cause of heart disease. This is where lifestyle becomes non-negotiable. Diet changes, smoking cessation, regular physical activity, stress management, medication adherence. Patients who ignore these steps often return to the hospital. Those who commit to change often gain years, sometimes decades of life. Let me share a real-world story. Section 7. A patient story. John was 56. He ignored chest pain for months. One night it became unbearable. Tests showed 3 blocked arteries. He needed bypass surgery immediately. He survived surgery, but that wasn't the miracle. The miracle was what happened after. He stopped smoking, lost 18 kilograms, walked every morning, controlled his blood pressure. 5 years later, John isn't just alive. He's active, present, and pain-free. Surgery gave him a second chance. His choices made it count. Section 8. Risks. Let's be honest. Cardiac surgery is major surgery. Risks include infection, bleeding, stroke, heart rhythm problems, memory changes, temporary in most cases. But here's the reality. Not having surgery when it's needed is often far more dangerous. Modern success rates are high, especially when surgery is done early and by experienced teams. Section 9. The mental side of heart surgery. Many patients experience anxiety or depression after surgery. This is normal and often temporary. The heart isn't just a pump, it's emotionally symbolic. Facing heart surgery forces people to confront mortality. Support matters. Family, cardiac rehabilitation programs, counseling when needed. Healing the mind speeds healing of the body. Conclusion. Cardiac surgery is not the end, it's a reset. Cardiac surgery doesn't mean your life is over. It means your body demanded attention and received it. With the right care, education, and commitment, people don't just survive cardiac surgery. They rebuild stronger, healthier lives. If this video helped you understand cardiac surgery more clearly, subscribe to Balanced Motion Health for honest, expert health guidance you can trust. Share this video with someone who may be facing heart surgery. They need clarity, not fear. And remember, knowledge saves lives, but action sustains them. See you in the next video.